Tenormin tablets is used with or without other medications to treat high blood pressure, hypertension. Lowering high blood pressure helps prevent strokes, heart attacks, and kidney problems. This medication is also used to treat chest pain, angina, and to improve survival after a heart attack. Active ingredient Atenolol. Atenolol belongs to a class of drugs known as beta blockers. It works by blocking the action of certain natural chemicals in the body, such as epinephrine, on the heart and blood vessels. These effects lower the heart rate, blood pressure, and strain on the heart. Indications. Tenormin is used to treat angina, chest pain, and hypertension, high blood pressure. Tenormin is also used to lower the risk of death after a heart attack. How to use. Take Tenormin exactly as it was prescribed for you. Follow directions on the prescription label and read all medication guides or instruction sheets. A doctor may occasionally change your dose. Your blood pressure will need to be checked often. Keep using the medication as directed and tell a doctor if your symptoms do not improve. You should not stop taking Tenormin suddenly. Stopping suddenly may make your condition worse. If you are being treated for high blood pressure, keep using this medicine even if you feel well. High blood pressure often has no symptoms. You may need to use high blood pressure medicine for the rest of your life. Usual dose for Tenormin for hypertension. Initial dose 50 mg orally once a day. Maintenance dose 50 to 100 mg orally once a day. Maximum dose 100 mg per day. Usual dose for angina pectoris prophylaxis. Initial dose 50 mg orally once a day. Increase to 100 mg orally once a day after 1 week if optimal response is not achieved. Maintenance dose 50 to 200 mg orally once a day. Maximum dose 200 mg per day. Usual dose for angina pectoris. Initial dose 50 mg orally once a day. Increase to 100 mg orally once a day after 1 week if optimal response is not achieved. Maintenance dose 50 to 200 mg orally once a day. Maximum dose 200 mg per day. Usual dose for myocardial infarction 50 mg orally twice a day or 100 mg orally once a day. Usual geriatric dose for hypertension. Initial dose. Consider reducing the starting dose to 25 mg orally once a day. Contraindications. Tenormin as with other beta blockers should not be used in patients with any of the following: hypersensitivity to the active substance or to any of the excipients, cardiogenic shock, uncontrolled heart failure, sick sinus syndrome, second and third degree heart block, untreated pheochromocytoma, metabolic acidosis, bradycardia, hypertension, severe peripheral arterial circulatory disturbances. Precautions. You should not use Tenormin if you have a serious heart condition such as AV blocks, very slow heartbeats, or heart failure. Do not stop taking Tenormin without first talking to a doctor. Stopping suddenly may make your condition worse. If you need to have any type of surgery, you may need to temporarily stop using Tenormin. Be sure the surgeon knows ahead of time that you are using this medicine. Tenormin is only part of a complete program of treatment for hypertension that may also include diet, exercise, and weight control. Follow your diet, medication, and exercise routines very closely if you are being treated for hypertension. Overdose symptoms may include extreme weakness or lack of energy, very slow heart rate, shortness of breath, or fainting. Tenormin side effects. Get emergency medical help if you have signs of an allergic reaction to Tenormin, hives, difficult breathing, swelling of your face, lips, tongue, or throat. Call a doctor at once if you have new or worsening chest pain, slow or uneven heartbeats, a lightheaded feeling like you might pass out, shortness of breath, even with mild exertion, swelling, rapid weight gain, or a cold feeling in your hands and feet. Common Tenormin side effects may include cold hands or feet, dizziness, tiredness, or depressed mood.